Welcome back, everyone, to another deep dive into the world of AI and healthcare. It's great to have you all with us. For those of you who are new to the show, this deep dive is specifically designed for medical students and healthcare professionals just like you.
Always exciting to be back.
Last time we talked about AI's potential in healthcare, and I have to say, I'm really pumped about today's topic.
Yeah.
We're diving into a groundbreaking study from NYUTron Health, and they've developed this new large language model. It's called NYUTron.
That's right, an LLM.
And get this, it can actually predict a bunch of clinical and operational outcomes.
Absolutely.
Some of the results are pretty surprising, like in readmission prediction, NYUTron just blew traditional models out of the water.
Blew them out of the water.
Yeah. So tell us, for those of us who maybe haven't had a chance to geek out on this study yet, what exactly is NYUTron?
So NYUtron, it's this new kind of clinical prediction engine.
Okay.
And it uses the power of, like you said, LLM, large language models. And what makes it really unique is that it analyzes unstructured data. And this is where it gets interesting for you guys.
Oh, really?
Yeah. Instead of just relying on that structured data, like your lab results, vital signs, all that stuff, NYUtron actually looks at clinical notes, the things physicians are writing.
Whoa, hold on. It's actually going through the notes that we take.
Yes. And that's a game changer because it means this model can learn from a much richer data set than ever before the actual words and thoughts of doctors.
That's incredible. So it's like it's taking all that knowledge that's locked away in our notes, all the nuances, and turning it into something actionable.
Exactly. I know it sounds kind of mind-blowing, right? But think about it. It's like having an AI that can actually understand the complex language of medicine.
It's almost like it went to med school itself.
Right.
So walk us through how it works. How does it actually process all that information?
So there are basically 4 steps. You collect the data, pre-train the model to understand medical language, kind of like teaching it the basics. Then you fine-tune it for specific tasks, and then finally deploy it for making real-time predictions.
Okay, so this isn't just some theoretical model. They actually put it to the test, right? Yeah. What did they have NYUtron do?
They put it through a pretty rigorous testing process on 5, I would say, quite diverse tasks, some clinical, some operational.
Interesting. So give us the rundown. What kind of things was NYUtron trying to predict?
So first off, they wanted to see how well it could predict 30-day all-cause readmissions. That's a big deal in healthcare.
Yeah, absolutely. Readmissions are a major concern for hospitals and for patient care.
Exactly.
What else?
Then they looked at in-hospital mortality prediction, always a sensitive but critical metric.
Okay, got it.
They also tested NYUtron on predicting something called the comorbidity index.
Okay, refresh my memory on that one. What's the comorbidity index again?
It's basically a way to measure the severity of chronic illnesses a patient has. So the higher the index, the more complex their health situation is.
Got it. So like someone with diabetes and heart disease would have a higher comorbidity index than someone with just high blood pressure.
Exactly. And that's valuable information for predicting things like length of stay and resource utilization.
Okay.
And speaking of length of stay, that was the 4th task, predicting how long a patient might stay in the hospital.
Makes sense. What was the 5th one?
Last but not least, they tested NYUtron on predicting something that's always a headache for hospitals. Insurance denials.
Yeah, insurance denials. Always a fun one.
Yeah, definitely a big deal for the operational side of things. So they really covered a lot of ground with these 5 tasks.
The big question is, how did NYUtron actually perform? Was it able to predict these things accurately?
The results were seriously impressive. Get this. Across all 5 tasks, NYUtron achieved an AUC that's area under the curve. Basically, a measure of accuracy between 78.7% and, wait for it, 94.9%.
94.9%. Are you kidding me? That's incredibly high. I mean, just to put that in perspective, how much better is that than traditional prediction models?
Well, we're talking about a 5.36% to almost 15% increase in predictive accuracy. It's a huge leap.
A huge leap. Wow. I mean, that's game-changing stuff.
It is. And remember, it's doing all this based on the notes physicians are writing. It's taking that really complex information and using it to predict important outcomes.
It's making me rethink the way I write my notes, that's for sure.
Right. Like, suddenly those notes are a goldmine of data.
Out of curiosity, of those 5 tasks that they tested, which one really stood out to you? Like, which one had the most surprising results, especially for future doctors like me?
I think the readmission prediction task was particularly interesting, just because, readmissions are such a critical issue in healthcare.
Absolutely. I mean, as future doctors, it's something we're all going to be thinking about. So how did NYUTron stack up against the traditional methods for predicting readmissions?
Well, not only did it outperform the traditional models, but the researchers did something really interesting. They actually put NYUtron head-to-head against a group of physicians.
Wait, really? They had doctors going up against AI.
Yeah, to see who could better predict readmissions. And the results were, well, you could say they were thought-provoking.
Okay, now I'm really curious. Spill the beans. Who came out on top, the doctors or the AI?
Well, before I answer that, there's another really interesting finding from this study. They found that NYUtron's accuracy actually kept increasing as it got more data.
Oh, wow. So it's like it's learning and getting better over time.
Exactly. Unlike traditional models, which kind of hit a ceiling in terms of how much they can improve, NYUtron just keeps getting better the more data it has. Imagine that. As you progress in your career, as you see more and more patients, this AI could become an even more powerful tool, learning from everyone's collective experience.
That's pretty mind-blowing. It's like the more we use it, the smarter it gets.
Precisely.
And it kind of makes sense, right? I mean, the more data it has to work with, the better it can identify those subtle patterns that might predict a readmission.
And this is where the importance of domain-specific pre-training comes in. NYUtron was trained specifically on medical records from NYU Langone. It's like the difference between having a general practitioner versus a specialist. This AI is trained to be a specialist in analyzing medical data.
So it's not just some generic AI, it's really tailored to understand the nuances of healthcare. Okay, I'm dying to know now, how did NYUtron fare against the doctors?
Well, the results were close,
Yeah.
but NYUtron actually achieved a higher true positive rate, which means it was better at correctly identifying patients who would be readmitted.
So the AI actually outperformed the doctors. That's pretty incredible.
It is, and I can imagine it might be a little intimidating too. Here we are spending years in med school learning all this incredibly complex information.
Right.
And now there's this AI that can predict patient outcomes just by analyzing our notes.
It makes you wonder what the future holds for us as physicians.
It does, doesn't it? And that's a question we'll definitely be exploring more as we continue this deep dive. But just to be clear, this was a retrospective study, so it was looking back at past data.
Okay, so it's not like NYUtron was making these predictions in real time in a live hospital setting.
Exactly.
But to really understand how this technology could be used in practice, we need to see how it performs in the real world, right? Did the researchers do any studies like that?
They did. They actually conducted a prospective trial where they used NYUtron to predict readmissions in real time in a live healthcare environment.
Wait, so they actually set NYUtron loose in a real hospital?
They did.
I'm on the edge of my seat here. What happened?
Well, we'll dive into those results right after the break, so stay tuned. They did. And the results were, I'd say, really promising. NYUtron was able to successfully identify over 80% of the actual readmissions that were happening in real time.
80%? That's huge. I mean, that's giving doctors a real chance to intervene and potentially prevent those readmissions from happening in the first place.
Exactly. Think about it. You get this alert that a patient is at high risk for readmission, and you can step in, adjust their care plan, maybe even avoid a whole bunch of complications down the road.
It's like having an early warning system for readmissions.
Yeah. It's about moving from reactive to proactive care, and I think that's incredibly powerful for both patients and for the healthcare system as a whole. But, the study was conducted at a single health system, NYU Langone.
Right. So how much can we really generalize these findings? Can we just assume that an LLM that's trained at one hospital is going to work just as well at another?
That's a really good question. And it's something that researchers are definitely looking into. Remember we talked about domain-specific pre-training?
Yeah.
Well, that means that an LLM that's trained on one hospital's data might need a little tweaking to perform optimally in a different environment. Almost like it needs to learn the local dialect.
Ah, okay. So every hospital has its own unique way of doing things, its own style of documentation.
Exactly. And their patient populations might be different too. So there's definitely more work to be done to figure out how to make these LLMs more adaptable. But still, the results from this study are super encouraging.
For sure. I mean, just the idea that we could use AI to predict readmissions with this level of accuracy is pretty groundbreaking. And then to think that it could actually get better over time as it gets more data.
Yeah, it's pretty remarkable.
So to go back to that prospective trial, you said they deployed NYUtron in a real hospital setting.
They did. They wanted to see how it would perform in a real-world scenario.
And it identified over 80% of the actual readmissions.
Yes. They were happening, in real time.
So what did the doctors think? I mean, did they actually find these predictions to be helpful?
This is where things get, I think, really interesting, because remember that physician panel who reviewed 100 cases that NYUTron had flagged?
Yeah.
Well, a significant portion of those cases were identified not only as potential readmissions, but as preventable readmissions.
Preventable. Wow. So we're not just talking about predicting readmissions after the fact. We're talking about potentially stopping them from happening altogether.
Exactly. And this is where it gets serious. Because the panel found that many of those patients who were readmitted, they actually experienced adverse events or even died.
Wait, are you saying some of those readmissions led to deaths that could have been prevented?
Yeah. And the panel, they felt that a lot of those outcomes were preventable.
That's a powerful statement about the potential of this technology. I mean, we're not just talking about numbers here. We're talking about real people's lives.
Exactly. Think about what this could mean for your future practice. Imagine, being alerted to patients at high risk of readmission, and you can maybe step in with additional interventions, closer monitoring. Who knows? You might actually save lives.
This is really making me think about how I would use a tool like this in my future practice. It's not just about reacting to problems anymore. It's about anticipating them, being proactive.
Right. And it changes the whole game. It's a paradigm shift in how we approach patient care. And here's another thing that the physician panel pointed out. They said that some of those preventable readmissions, they actually involved complications that happened during the initial hospital stay, things like infections.
So you're saying that maybe we could use AI to identify patients who are at risk for those kinds of complications before they even happen?
Precisely. I mean, think about it. We could potentially prevent those complications from happening in the first place, leading to safer hospital stays and much better outcomes for patients. And that's what I think makes this research so compelling. It's not just some theoretical idea anymore. It's showing us the real potential of AI to make a tangible difference in people's lives.
This is really eye-opening. It feels like we're on the cusp of a major shift in healthcare.
Oh, absolutely. And it's an exciting time to be entering the field, that's for sure.
We talked a lot about NYUTron and its capabilities, but this is just one example of the incredible advancements that are happening in AI for healthcare right now.
It's a rapidly evolving field, and it's essential for all of us to stay informed and engaged.
Absolutely. So what else is out there? What other AI applications should we be aware of as future healthcare professionals?
Oh, there's so much happening. It's hard to even keep up.
Give us the highlights. What should we be paying attention to?
Well, one area where AI is already making a huge impact is in diagnostics.
Oh, really? You mean like actually helping us diagnose diseases?
Yeah. We're seeing AI-powered systems that can analyze medical images, things like X-rays, CT scans, even those pathology slides, and they're doing it with incredible accuracy.
So it's like having, a second set of eyes? But these eyes have been trained on millions of images, and they can spot those tiny little details that even the most experienced radiologist might miss.
That's exactly it. And think about what that means for you guys as future doctors.
Yeah.
These systems can help prioritize cases, they can flag potential abnormalities that need closer inspection, and ultimately they can really speed up that whole diagnostic process.
Which means faster and more accurate diagnoses for patients. I mean, that's a win-win for everyone.
Exactly. And it's not just limited to medical imaging.
Oh.
AI is being used to analyze all sorts of patient data, from genomic information to electronic health records. And it can help us identify potential risks and personalize treatment plans in ways we never could before.
That's where that whole idea of personalized medicine comes in, right? Tailoring treatments to each individual patient based on their unique characteristics.
Exactly. AI can help us understand how individual patients might respond to different treatments based on their genetic makeup, their lifestyle factors, their medical history, the whole picture. It's about moving away from that one-size-fits-all approach and really embracing the complexity of each patient.
That does sound like the future of medicine. But with all this amazing potential, I keep thinking back to those ethical considerations we talked about earlier. As AI becomes more and more integrated into healthcare, we have to make sure it's being used responsibly and equitably.
Absolutely. We have to be super vigilant about potential biases in the data that's used to train these models. And we need to make sure that AI-powered healthcare benefits all patients, regardless of their background or circumstances.
I think that's a really important point. As future healthcare professionals, we have a responsibility to advocate for those ethical considerations. We need to make sure that AI is being used to improve healthcare for everyone.
I completely agree. It's an incredibly powerful tool that has the potential to revolutionize healthcare as we know it. But we need to guide its development and implementation very carefully, always putting patient well-being first.
Well, this has been an absolutely incredible deep dive into the world of AI in healthcare. It's amazing to see how far we've come and just how much potential lies ahead.
I know, it's truly a remarkable time to be in healthcare, especially for you, our future doctors. You're entering the field at such a pivotal moment.
We've covered so much ground today, from the nuts and bolts of how these LLMs actually work to the real-world applications of AI in diagnosis and treatment. But I think, most importantly, we've highlighted the critical role that you, as future healthcare professionals, will play in shaping the future of AI in medicine.
It's going to be up to all of us, researchers, clinicians, policymakers, even patients, to ensure that AI is used ethically and effectively. We need to create a healthcare system that's more accurate, more efficient, and more patient-centered than ever before.
Well said. Thank you so much for joining us on this deep dive.
It was a pleasure to be here.
And to all of you listening, thank you for being a part of this conversation. We hope you found it informative and maybe even a little bit inspiring.
Keep asking questions.
Keep exploring. And stay tuned for our next deep dive, where we'll continue our exploration of the cutting edge of medicine.
See you then.
Until then, stay curious and keep learning.